What are some health complications that occur in newborns during their first week of life?
In the hospital, the first sort of physiologic thing that might be a problem is that the baby might develop jaundice. Physiologic jaundice typically occurs toward the end of the second and into the third day of life. Jaundice that is present at birth is not physiologic, and that's a proper medical problem. Jaundice is a problem mainly in sick babies and in babies who are premature. And the worry about that is that the yellow pigment can deposit in the brain and cause a condition called connectivus. Babies do lose weight in the first 2 days, and it's not really so much fat weight. There is a bit of fat weight loss, but it's actually the fact that they're changing their distribution of water. So they're born at like 80% water, and in the extrauterine life, they go down to about 70%. So some of that weight loss is just water. Now, there are some babies, uncommon, but it does happen, who develop an infection in the first few days of life. Neonatal sepsis is a huge, huge problem. So neonatal sepsis is the fact that babies are relatively immunocompromised, and when they're born, they can be exposed to organisms in the mother's birth canal that can set them up for infection. So the first few days is an adaptation. Then once you get home, it's a case of fitting this little person into your environment.
The soft spots, so we're always so nervous, about the most popular soft spot. Is there anything else we should know about in terms of soft spots and how to?
There's nothing particularly sinister or exciting about soft spots, except there is only skin between the outside world and your baby's brain. We can see the state of hydration of a baby. If you're worried about meningitis, one of the things you look for is to see if it's got a bulging fontanelle. Actually, it's our window to the brain. If you want to have a look at a baby's brain, you don't have to do a CT scan to start with. You can just use an ultrasound and look through the fontanelle.
Moving on to the little boys. Yes. Circumcision. To do it, not to do it. I mean, we took the decision to do it. I don't know if it's a cultural or hygienic thing or a medical thing.
Let's take tradition, culture, religion, everything out of it completely. There really are very, very few pure medical indications to do a circumcision. Okay? You don't need to circumcise. However, if it's part of your culture or part of your religion, then that's what it is, and that's perfectly reasonable. There are some times when you don't want to circumcise. For example, there is a medical condition called hypospadias. So in hypospadias, the opening of the urethra is not at the very tip of the penis. It can be round the corner, all right? Okay. And what happens then is the foreskin doesn't wrap completely around it. Until that's repaired, you need to leave the foreskin alone because some of the foreskin tissue may be needed in the repair. But in the normal, healthy baby, then you should go ahead and do it early. And in fact, early is probably easier than doing late because you can do it with local anesthesia and the Plastibell clips. Whereas later, what happens is it becomes more of a surgical procedure. It's going to require a general anesthetic, etc. In the first week before you leave the hospital, that would be the preference.
Doctor visits. The first one happens when?
So what I like to do in my practice is I like to see the baby and the mom within the first 10 days. The reason I like the 7 to 10 day visit is the mom should have established her breastfeeding by then. So we'll know how she's doing, we'll know if she's got mastitis, we'll know if the baby's latching properly. And we can see also how she is. Is she okay? Has she got a bit of postpartum blues? Then we want to check that the jaundice is gone. We want to check that the bilirubin is normal. And we want to make sure that the baby has got back to his or her birth weight. So you should achieve your birth weight by 7 to 10 days.
The coronavirus, a lot of parents are maybe holding off taking their babies to the pediatrician or, they're not really sure what is considered something serious and what's not. What should I just, give my doctor a call for? So what would you recommend parents in this case?
The healthy babies must still get their vaccines. I think it's very important that the normal baby checks and the normal developmental checks and the normal vaccine checks still go ahead. What we try to do, what we've done with the sick child, is if it's acute, severe illness, it's straight to hospital. That's a phone call and it's straight to hospital. If it's something that we're not totally sure about, what we've done is we've set up video consultations. If there's exceedingly low risk of the child being a corona patient, we'll make special attempts to bring the child to the clinic at a time when the clinic is quiet, when there's few people around, we have proper personal protective equipment, and we see them like that. If we're a bit worried about the patient and we feel they need more acute attention, might need testing, then we've sent them to the hospitals.
So can newborns catch corona? That's the big question, doctor.
So it seems that you don't get it from the mother through the placenta in the pre-birth process. Newborns have been shown to get coronavirus early on. Corona itself does not seem to be a major problem for small babies. Even though babies are prone to infection, there are not many reports of newborns getting into a lot of trouble.
Shall we move on to feeding? Let's start with breastfeeding, I guess.
There is no doubt in all of medical literature that breastfeeding is the way to feed your baby. The trick comes to work out what to do when the mother can't feed. There are babies that can't. Can we maybe pump and give the baby breast milk out of a bottle? Worst case scenario would be the mother who can't breastfeed at all. And then we would have to use formula. Not everybody can breastfeed. And if they can't, our primary goal is to make that baby grow.
I'm gonna go into medicines because you mentioned it, quite a bit, and it's a big one, to be honest, with newborns.
Newborn babies who are healthy and at home don't need medication. Panadol should only be used for children who've got fever. Zyrtec is a non-sedating antihistamine. Zyrtec's only role is in treating allergic diseases. It's not there to make babies sleep. It's not there to dry up their noses. It's not there to help them with ear infection. Antibiotics should be only prescribed by doctors, and it should only be given when there is a clear indication that you're dealing with a bacterial infection.
Pacifiers, do you recommend them to soothe baby?
So there is less sudden infant death syndrome in babies who use pacifiers. If a baby uses a pacifier instead of the thumb, you will have less orthodontic bills in the future. If your child is above 6 months of age and goes to nursery school, children who use a pacifier in that setting get more ear infections.
Lots of cases of flaky skin or discoloration, babies looking a little dark or purple.
The babies who tend to come late, so after 40 weeks, they tend to peel. It'll be all dry and cracking and peeling. Those babies that were small for gestational ages, they tend to have wrinkled kind of skin. Just moisturize them and they're fine. Babies will often have a big purple mark either on their bottoms or on their shoulders. Not so common in ultra pale skins like me, and it disappears with time. It's not a disease, it's nothing to worry about. Big black hairy moles, those need to be seen.
Hello, what are your thoughts on plant-based formulas?
If your baby likes a soya formula, it's fine. If you're vegan, it's fine.
She's asking about giving water to a newborn baby, especially during the summer.
The absolute strict guidelines are don't give water to babies in the first year. But these guidelines were obviously written by people who lived in temperate environments. If you've gone out for a walk in the morning nice and early and your baby's a bit pink and flushed and you feel a bit, yes, 10 or 15 mils of water is okay. But we must just be sure that that baby isn't substituting the water for food.
Sadia, she's asking Dr. Loubser, could you give more guidance on a technique used to take the in-ear temperature accurately and correctly?
So the way to straighten the canal in a baby is to take the ear and just to pull it slightly outwards and a little bit backwards. So you hold the thermometer in one hand and you pull back and then just point it directly 90 degrees into the ear and choop, and you should get a good reading.
Yevgenia Getalo, is it normal for the 4-week-old to be tensed, cooing, stretching, and bending his legs all night long in his sleep? He's crawling around in his sleep and just won't settle for a night.
Some babies are like that. They, you've got one of the active ones. Yeah, they look. You don't want to over swaddle them. You want to make sure that everything's right. Some babies are just restless babies.
And what do you think about shampoos, nappy creams? Should it be at a minimal, all the products you use on a newborn?
Where we get people getting rashes is because their skins are dried out by highly chemicalized products or by perfumes. So use things that are parabens free and perfume free.
Nuria has another question here. What's the doctor's opinion on going out for a stroll during the day with a newborn in the Dubai heat?
So I would say be super careful. If you're going to take your baby out, I would do it before 9 in the morning and after 4:30, 5 o'clock in the evening.
Pillow for a newborn baby?
The answer is no. So you should have nothing else in the crib. The general rule is nothing that your baby can get their face up against.
Doctor, thank you so much. This
My
was
pleasure.
really just so detailed, so amazing, so informative.